Hi, I'm Dr. Knox Beasley, a board-certified dermatologist specializing in hair loss. This is your quick introduction to hair loss. Also called alopecia, hair loss comes in many different types, like male pattern hair loss from autoimmune conditions or vitamin deficiencies, hair loss caused by stress, and others. And each type of hair loss comes with its own set of symptoms and treatments. Some forms of hair loss can be reversed, and the earlier the treatment begins, the better the outcome. Hair loss symptoms depend on the type of hair loss someone is experiencing. For example, classic symptoms of male pattern hair loss are the M-shaped receding hairline or hair loss at the crown. Hair loss can be sudden or gradual and can be permanent or temporary. Other symptoms can include hair loss on different areas of the head or body, bald patches, overall thinning, sometimes irritation on the scalp, and even changes in the skin or nails. Hair loss can be broken down into two categories: scarring alopecia, where follicles are irreversibly damaged, and non-scarring alopecia, where follicles are preserved, so hair loss is potentially reversible. These are the most common types of hair loss. Male pattern hair loss is mostly due to genetics and the DHT hormone, which shrinks hair follicles. Telogen effluvium is hair loss that occurs rapidly from stress or big life changes like being in an accident, having surgery, losing weight, or starting a new medication. Alopecia areata is an autoimmune condition, and traction alopecia is caused by hairstyles that pull the hair too tightly for too long. Vitamin deficiencies like biotin or iron can also cause hair loss. The risk factors for hair loss are as varied as the types of hair loss, but the common factors are genetics, age, certain medical conditions, taking certain medications, stress, and sudden life changes. It's completely normal to shed 50 to 100 hairs per day, so not all shedding is cause for concern. Here's how hair loss issues are diagnosed. A healthcare provider will consider medical history, any new medications, how long ago the hair loss symptoms began, and if hair loss runs in the family. A physical exam may also be required to look at the hair, skin, and nails. And in other cases, a scalp biopsy or microscopic hair exam may be recommended. First, it's important to understand what type of hair loss you have, and keep in mind that it's also completely normal for hair loss to get worse with treatment before getting better. The two most common treatments for male pattern hair loss are finasteride and minoxidil. These come in both oral and topical forms and can be used separately, together, or even compounded into a single, personalized medication. Finasteride helps to block the production of DHT to stop hair loss, and minoxidil helps increase blood flow to the hair follicles to help regrow hair. These medications are available through online platforms like Hims if prescribed. Other treatment options include things like ketoconazole, dutasteride, low-level laser therapy, platelet-rich plasma injections, or hair transplant surgeries. Since genetics play a big role, it may not be possible to completely prevent hair loss in all people. That said, some great ways to help prevent hair loss are eating a healthy diet, managing stress, taking care of underlying conditions, and practicing good hair habits like using gentle hair care products and avoiding tight hairstyles. And remember, the earlier you start prevention and treatment, the better. If you're interested in treatment, be sure to connect with a healthcare provider. You can read more in depth and get a free consultation through Hims.